Okay, so today we're going to be talking about doing oral cares on intubated, mechanically ventilated patients. We do this in order to help prevent ventilator-acquired pneumonia, and we do these cares every 2 hours for those patients. So upon entering the room, of course you've knocked, you're going to wash your hands, and you're going to assess the patient, including vital signs. You want to check for any damage to the ET tube, and then you also want to, of course, make sure that you've applied appropriate PPE. Gloves is a must. So once we get started, the first thing we're going to do is attach this kind of Yankauer type suction catheter. Suction goes to the wall at -100 to -120, and then what you're going to do is just kind of remove the sheath, and you're going to suction out any secretions that may be sitting in that patient's mouth. We don't need any of that to be sitting in there, and of course they aren't able to get it out themselves. So we're using this around the tube on either side to get those secretions out. This sheath is just sort of a protective mechanism to help keep it as clean as possible. So once we've done that, then in 2 hours we're going to come back. We're going to use the toothbrush attachment, which we'll attach right here. I don't have that one, but to use that you're going to apply a toothbrush or toothpaste type of agent, and you're going to brush the teeth. We're going to brush far back, then we want to get the molars. We want to get the front of the teeth. We want to get the incisors. We want to get all the teeth and all the surfaces. We want to make sure we're getting the sides. We want to make sure we're getting the tops of the teeth. We want to make sure we're getting that gum line. And we want to be gentle so that we're not hurting the patient, but we want to be doing a thorough enough job that we're actually getting the mouth clean. So once we've done that and brushed the teeth well, then we can turn on the suction and suck out any of the secretions that may have been left behind. And then before we leave that patient's room, we need to apply a mouth moisturizer to all of the internal surfaces of the mouth as well as the lips to make sure that our patient's mouth is nice and moisturized. So in 2 hours, we're going to come back into the room. Then we're going to apply this suction catheter that's much longer, and that's what's going to help us to get the secretions out farther back into the throat. So the patient isn't able to actually cough up or expectorate anything because they're ventilated or because they're intubated, and so we are using this catheter to do that for them. So we'll use this catheter to suck out any of those secretions. Then in 2 hours we come back, we have this next attachment, very similar to the toothbrush. So we're going to dip this into this debriding agent, and we're going to clean the surfaces of the mouth. We want to get the tongue, we want to get the cheeks, the roof of the mouth, we want to get the gum line, we can go over the teeth. We want to make sure, again, that we're not being too gentle or too rough. There's a happy medium for that. And then of course, once you finish the cleaning, you turn on the suction and suck out the secretions. If you have the suction on while you're cleaning, it sort of is contradictory because you're not actually able to get the mouth as clean when you're sucking stuff as you're cleaning. So you should just clean the mouth first, and then once you've finished, go back and suck out those secretions. And then last but not least, we're going to moisturize that mouth again. All the internal surfaces of the mouth as well as the lips, and it's really important that you have that patient's mouth moisturized. So then before you leave, you want to check the ET tube for any damage, and you also want to assess the skin where that ET tube has been sitting. You want to check that integrity to make sure that the patient does not have breakdown where that tube has been sitting. So that is how we do oral care for these patients. We do it every 2 hours, and we do them to prevent ventilator-acquired pneumonia.